It might be that the symptoms get a bit stronger, but most likely because the chemotherapy in itself has side effects. And what we frequently forget, and we are looking into this with colleagues in oncology at the moment, is we always assume that once you have had chemotherapy and you're cured, if you're lucky, that's it. It's over, you're done, you're cured, you're fine, you go back to your regular life. And in some cases this happens, and these people are very lucky and they have no symptoms anymore. In many cases, even 3 to 5 years to 10 years after chemotherapy, people still have some kind of symptoms of some kind of unexpected side effects or side effects of the therapy that are still there. They can be strong or they can be minimal, but usually people have some long-term side effects. And what we know is that when it comes to the biological, say, side effects, the changes in the blood and also nausea or pain, these are more frequent in women. So we looked in large cohorts and we found that these symptoms tend to be more prevalent in women. And then we have also looked at other psychological factors, and it is quite interesting that in patients who have had chemotherapy, men seem to suffer long-term more of the change of their lives. So the fact that maybe they cannot go to work as they did before, they need to work less, or some activities they had, they cannot do as much anymore. So there is a difference in the way I see myself and I perceive myself. So I think it is not so much that the symptoms of Parkinson increase. So it's not the disease in itself, but I think what happens is on top, you get these long-term side effects of having had a chemotherapy, which somewhat are similar to Parkinson symptoms. And so I think it's not so much that this necessarily makes the disease progress. Of course, some of the chemotherapies can have a toxic effect that can also affect the brain cells. So there is a possibility biologically that this gives a progression, but it's also well possible that then it regresses after you finish chemotherapy. But long term, there are some side effects that will stay there and which will make coping or some functions more difficult. So if you feel weaker because you have changes in your blood cells, this might well also make you weaker and will give you more instability, for example. So maybe the instability is due to Parkinson, but maybe the instability is because you don't have enough red blood cells. So it might be that there is this on top, so it's not the disease of Parkinson so much progressive, but other things that come on top and make you feel some of the symptoms that you have anyway stronger. So this is possible.